Hi, I'm Dr. Parks, and today I'm answering a question from Kathleen. She wants to know what the difference is between natural medicine, which is what I do, and regular medicine. So, Kathleen, that's a question that doesn't get a lot of attention, and I will be right back with your answer. So, Kathleen, natural medicine versus regular medicine, or as we like to call it, allopathic medicine, which is kind of going to a regular doctor and getting diagnosed or treated with, it's usually drugs or surgery or some combination of, allopathic medicine versus a natural doctor, which I am. So I do naturopathic medicine, and I like to tell people that the biggest difference between what I do and what your regular specialist or primary care doctor does is the philosophy. So the philosophy, I think, sets these two schools of medicine apart, and it's really important that you understand this. Naturopathic medicine is based on a foundation of philosophy that I take very, very seriously. There are 6 different naturopathic philosophies, and I won't go into them now, but I will have a link to them later. But these really are the foundation of what makes up what I do, and I use them to guide me through all the treatments. But in terms of what you need to know as someone who is consuming different types of medicine, is the foundational difference is how we approach health. Now, with naturopathic medicine, our job is to really look for the underlying concern. We don't necessarily treat symptoms, or we don't treat diseases. In my office, we actually don't even diagnose anybody with anything. My job is to figure out, okay, what's not working well in your body, what system, what organ, what's not doing its job, and how can we help your body do it. With allopathic medicine or regular medicine, the focus is a little bit more on, okay, what's the diagnosis, what's the disease, what's the symptom, and what can we do to suppress it. So, for instance, you have, I love this example. If 10 patients walk into my office and all 10 people have headaches, they have migraines. I see 10 people in a day and all of them have migraines. Chances are every single person walks out of my office with a different plan, with a different prescription, with a different protocol to address those migraines. This is because with naturopathic medicine, we're looking for the cause. We're not treating the pain. Because if you're treating pain, you're going to have to keep treating pain over and over. And anybody who's ever suffered from any kind of chronic pain knows what I'm talking about. You always are treating the symptom. When you really look at the individual and figure out, okay, what's causing her migraine as opposed to what's causing his migraine, they're probably 2 different things. So then those are 2 different people. So how we approach each case is very individual. So the individual nature comes back to our philosophy of making sure that we are looking at the underlying cause. And that's the major difference, because if you walk into, an allopathic doctor's office and you have 10 people with pain or migraines, chances are all 10 people will get pretty similar treatments. They may, honestly, they'll all get a painkiller. So they may get a different type of painkiller for each one. But the truth is, most doctors will pretty much write the same prescription because it works. Like in that model of medicine, it actually works to dull the pain and it works to suppress the symptom, but what's missing is really correcting the underlying problem. And allopathic medicine isn't really necessarily focused on that. Allopathic medicine is to make sure that you get out of pain or you don't die. In a case of emergency, say I broke my leg, hopefully I don't break my leg, but if I do, I don't want to go to a natural doctor. I want to go to an allopathic doctor. I want as many drugs as possible. I want surgery because that's what's appropriate for that situation. I'm definitely not against drugs, but what I do believe is that they're not vitamins. They're not food. You shouldn't have to take them every day just to function. They should fix a certain issue, and then you should stop taking them. If you're taking blood pressure medicine, for instance, for 20 years and you still have to take blood pressure medicine, or you need to add a second or third medication because that medication is no longer working, we never fixed the problem. You just took drugs for 20 years and you had the same problem you had 20 years ago. And in fact, the problem is now worse because we never fixed the problem. So with naturopathic medicine or natural medicine, we're definitely looking at the whole picture. We're looking at you as a whole person. We don't specialize in different areas of your body. That's one more big difference. There's not like, some naturopathic doctor will focus in like different areas, but the truth is none of us are specialists. We really look at the whole picture, we look at the whole body, and our job is to really try to address the underlying cause. So I have prepared a really neat handout for you. And if anybody's interested in this, you can just go ahead and go to drparks.com/naturalmedicine, and it will walk you through some little tips that you can start using today in your own health to start incorporating more of the principles of natural medicine. Now remember, when you have health questions, ask Dr. Parks.